Well, welcome back to America Decides. To much fanfare, President Trump signed an executive order today that he said was aimed at lowering prescription drug costs by having the United States government match the lowest prices paid for some medicines by other nations and cutting out what he called middlemen.
Nobody knows who they are, middlemen. I've been hearing the term for 25 years, middlemen. I don't know who they are, but they're rich. They're worse than the drug companies. They don't even make a product, and they make a fortune.
Joining me now, Dr. Richard Besser. He formerly served as the acting director of the CDC. It's great to have you with us, Doctor. Give me your general reaction. I've watched many presidents that I've covered try to tackle this issue. Disparity in drug prices through executive orders. They don't go very far. Congress has to be involved. The president said today that Congress is owned by Big Pharma. Can't do it. The only way I can do it is through an executive order. Is any of this actually going to happen?
Well, Major, we'll see. I don't have a lot of faith that an executive order is the way to get this done. There is legislation that allows Medicare, part of the U.S. government, to negotiate drug prices, and that I think would be a much more effective way to do this. The point is well taken, though. We spend more on drugs than any other wealthy nation. In America, your ability to pay for your drugs has a lot to do with whether or not you have health insurance, and that's tied very much to whether you have a job. This administration is doing a lot to take away health insurance from individuals. The proposed cuts to Medicaid could lead to millions of people losing their health insurance. So while on the one hand, I support efforts to reduce the cost of drugs that people are paying, that should be something that is benefited by everyone in our country by making sure that everyone has access to health insurance.
And just to your point, Doctor, what happens in Congress, where Republicans, as you just indicated on the House side, are making changes to Medicaid and access, that would be real. Executive orders, much less real. So what's happening in the real world legislatively could have much more significant impact than this executive order.
Exactly. An executive order like this is good television. What's happening in Congress is quite worrisome. The idea that hardworking people who have jobs that don't come with health insurance may lose their health insurance because they're going to be excluded from Medicaid, that is really worrisome and shouldn't be something we see in our country.
Talk to my audience, if you'd be so kind, Doctor, about where we are with measles, how alarmed or non-alarmed you are, and what context we should put it in.
Major, I'm very concerned. We have seen more than 1,000 cases of measles this year. 25 years ago, the U.S. was certified as having eliminated measles. And while we've seen cases every year since then, we haven't seen the kind of transmission that we're seeing now. There have been 3 people who've died from measles. And the big concern is that, that number you see there of 709 cases in Texas. Well, viruses don't respect borders. So we are going to see this virus spreading to any community that hasn't been able to maintain very high levels of measles vaccination. And we currently have a Secretary of Health who, before he held that title, did more than just about anyone in our nation to undermine people's trust and confidence in our vaccine system. I practiced pediatrics for over 30 years. And there was nothing I did as a pediatrician that had more value than making sure my patients were vaccinated fully and on time. And that took the spending time with each patient, answering their questions, making sure that they felt comfortable in their decision to vaccinate their children. So I recommend to viewers, talk to your doctor, talk to your nurse, talk to your pharmacist, and see what their perspective is on vaccination, because it clearly, from my perspective, is the best way to protect your family, your friends, your neighbors, and your community.
And Dr. Besser, as you know, this particular administration is not shy when it comes to communication. It talks a lot about a lot of different subjects. Could it be more emphatic about vaccinations and this particular outbreak?
Definitely. There is nothing that you can do that has more value in a situation like this than checking to make sure your child is vaccinated, that you as an adult are fully vaccinated, because this is the most contagious virus that we know of. And so if you have a community where fewer than 95% of people are vaccinated, a school with lower than 95%, you will see spread. And unfortunately, it will be seen in those children who may not have been able to get vaccinated because they may have a disability, they may have a medical condition that prevents them from getting vaccinated. We need to make sure that we protect everyone in our community by ensuring that we are vaccinated ourselves.
Dr. Richard Besser, thank you so much for your time, sir. I appreciate it.
Thank you, Major.